Now today I'm going to be showing you how to use Teladoc Health. Teladoc is a telehealth platform which allows you to access virtual care that includes primary care, mental health care, chronic condition management, and more. Now, Teladoc Health is accessible through their website. However, if you're using a phone or tablet, it's preferable to use their application, their app, which you can download from any app store, the Google Play Store or the Apple App Store, and just search Teladoc Health and you should find it there. But today we're going to be using their website as our example. That being said, this experience looks pretty much the same across the board. There may be slight variations in where certain buttons are located, but the information itself, how you access services, is the exact same across all devices. So, if you are coming here for the first time, you will need to register, and you can register by clicking either Get Started Now right down here, or Register Now up here in the top right corner. When you register, it's just going to ask you to fill out some basic information about yourself. Things like your name, your email address, your country, zip code, gender, birthday, etc. So you'll start by filling out this form. So once that's filled out, click Next. The next page will ask you to provide your insurance information. Now you can click on this little area that says name of insurance company, and you'll see a large scrollable list you can go through to select your coverage. So you can go ahead and look for it. It's listed alphabetically. Once you put that in, you'll then put in your member ID number or whatever information is required from that specific provider. And then you'll click Next. Now, if you don't have insurance, that's also okay. There's no button here to say I don't have insurance, which is a bit odd, but you can scroll down, just select other, type in none, and then click Next. What will happen is it says we couldn't confirm your coverage, but there'll be a small bit of text here that says no insurance coverage. You can also pay per visit. So you can click on that. And then you'll be able to have the option to just pay out of pocket for services. You'll see all the cost breakdowns here of those visits, and you can just click continue with telehealth care options. So you have that there. So either way, you've put in insurance, you haven't put in insurance, we're just going to finish up creating our account now. And so you'll need to do a few things: create a username, a password, confirm that password, and then enter in your address information. You will also have to answer a few security questions so that you can secure your login better. So when you get to this section, you can click these areas that say select and select one of the options you would like to answer, put that in, and then answer your question for each one. And then lastly, visit preferences. So put in your country code, then your phone number, your preferred language, and then all you'll have to do is click I accept Teladoc's privacy and practices, terms and services, etc., and then click create account. Now at this point in time, once you've created the account, you will be automatically logged in. However, I do want to show you the sign-in process for when you are returning in future to your account. So if you're returning to your account and you've already registered, when you come to teladoc.com or you open up the app, if you don't happen to be signed in, just look for this sign in button up here in the top right corner, right next to where you clicked register now. If you're on the app, the login form should just be right in front of you, so it's a bit simpler. But in this case, we'll click sign in. So I'll put in my username, my password, and then just click sign in. Great. So when you're first logged into your account for the first time, they will ask you to fill out a bit of medical history. You can also select a pharmacy. And if you have any dependents on your insurance, you can also add them at this point in time. That is optional. Filling out your medical history and selecting a pharmacy are things you must do before your first visit. So to complete these forms, just click on the boxes. And then again, this is just another form, much like you'd fill out at the doctor's office, with information about you, including your height, your weight, allergies, lifestyle stuff like do you smoke, do you drink, and any existing health problems. So you'll have to scroll down and fill out this form to the best of your ability. And then when you're done, you just click Save. Now, next thing to get done is to select your pharmacy. So you should be shot back out to this front page and you'll see this option here, select pharmacy. And then simply just click Add a Pharmacy. And you can do this a couple ways. You can search it by location, so you can enter a zip or postal code in a city or state. So we'll just do an example of this. So put in that zip, a radius of how far you would like it to be within, and then click search. And it will show you a map view. You can also see a list view to select the pharmacy you want to use. Say I select this Duane Reade, and that's my pharmacy. If you did want to add a pharmacy manually, just click where it says Add Pharmacy Manually, and you can put in the pharmacy name, phone number, address, city, state, zip code, and then click Continue. Now that all that information has been provided, you can start to get care using the Teladoc Health app. Now there's a few options, and these options may vary based on your coverage or lack of coverage. So 24/7 care, you can see a doctor as soon as possible for non-emergency needs. So you'll just click on Talk to a Doctor and you can find one. There is also mental health services, dermatology services, nutrition services, and more, again, dependent on your coverage. But for your most basic needs, say you are looking to see a doctor, you can just click on Talk to a Doctor. You'll select who needs help. So if you do have any dependents on here, they should pop up here. So select you or whoever is making the appointment and click Continue. Select the state you would like to receive care within, and then select how you would like to connect, via a phone call or video call. And at this point, you will see the current wait time. At this point, it's 10 minutes or less to see a doctor, so very, very soon, very quick turnover. This is an estimate, however, so it can vary. What you can do next is select your time zone. It should be automatically where you are, but just make sure that it's correct. And then click when you'd like to receive care, ASAP, so within that 10 minutes that it's predicting, or today or tomorrow. Say I want to select tomorrow, it then will ask me what time I'd like to. So say 8 a.m., I'll click Continue. It's going to ask me then to select my reason for my visit. So this just gives the doctor you're going to see a bit more information, again, much like when you are at the regular doctor's office. So you fill out this form. And lastly, share up to 3 files and photos with the provider. So say what you're experiencing is a rash or some sort of visible condition, you can upload photos ahead of time just to give the healthcare professional you're seeing a bit of an idea of what's going on. This isn't required, but it can help. So up to your discretion whether you choose to upload photos before your appointment. Again, confirm the pharmacy you're going to use. So if you do receive a prescription through this visit, you'll want to confirm which pharmacy it's going to be sent to. Now at this point in time, if you do have coverage, it will tell you what portion of this is covered and how much you may have to pay out of pocket, or it will deal with your insurance. However, if you don't have coverage at this point, this is when you'll add a payment method or card to be able to pay for this visit. So this is the cost, and if I need to add a card, I just click Add Card. And then once I've added that card, click Continue. And at this point, you will receive a confirmation of your appointment time via email and on the screen in front of you. All right, so at this point, you have scheduled your visit. Perhaps you've already had your visit with the doctor. There's other things that you can do on this platform besides just make appointments and have them. So you'll also have up here in the top of your screen, so you'll automatically usually be taken to a section called Get Care. There are also additional sections, and on the computer they appear in this top bar. However, on a phone or tablet, they'll be at the bottom of your screen on a bottom kind of section of buttons. So you'll find the same buttons just located in different locations. So first of all, Health Info. This will show you all your past telehealth visits, any sort of documents from your visits, your medical history, which you can always go in and adjust, pharmacies, and any sort of providers. So you can always click into any of these sections to either view past visits or any documentation from your visits, or to change or update any of your medical information. You also have a section up here called Messages, and this is just a messaging center. I don't have any messages yet, but this might include post-visit summaries, provider's notes, or your prescription. So any communications with the healthcare professionals you are meeting with, if they communicate with you after the fact, will be here, and you can converse and respond and get any information you need. Next, we have our account section, and here you'll see basic information about your profile, your security and login, communication preferences, an area to add your emergency contacts, family, so you can manage your dependents and authorize consenters and care recipients, and billing and coverage. So again, clicking into any one of these sections, you can make edits. So something like billing and coverage, if you didn't put in coverage when you first logged in, you can still come in and change that after the fact. This is also where you will sign out of your account. Now, I do suggest signing out if you are sharing the device you're using with anyone else, just to protect your information and privacy. All right, we hope you found that helpful, but if you ever have any additional questions about Teladoc, telehealth, or really anything tech related, you can always call us toll free at Cyber Seniors at 305-419-0906, or visit us online at cyberseniors.org.